Ever felt frustrated being told PMS, heavy bleeding, and cramping are just normal parts of life? You are not alone. I loathed my monthly cycle for decades. That all changed when I earned 3 health coaching certifications, discovering something incredible. Your period is vital. It is an outward sign of your inner health, and it holds the key to unlocking your full potential. I've been there battling heavy, painful periods, and I turn them into cycles with minimal PMS and cramping. Today, I'm on a mission to share that information with you. Pour a cup of your favorite drink, get comfy, and grab your headphones as we embark on a candid and empowering journey of self-discovery. Together, we'll demystify menstrual cycles, explore cyclical living, delve into natural birth control, and guide parents through those crucial period talks with tweens and teens. It's time to break the taboo around menstruation and embrace the wisdom it holds. I'm your host, Heather Almendinger, and this is the Embracing Flow podcast. Hello, everyone, and thank you for joining us on Embracing Flow. I'd like to introduce our guest today, an expert at Embracing Flow, Sarah Krotulski. Sarah, thank you so much for joining us today. How are you?
Thank you for having me. I'm excited to be here. I'm good. How are you?
I am doing fantastic. Thank you so much for asking. Listeners, Sarah is here because she is a doctor of physical therapy, a pelvic floor physical therapist, pregnancy and postpartum corrective exercise specialist, certified athletic trainer, and has a certificate of achievement in obstetric physical therapy from the American Physical Therapy Association. She has been a physical therapist for over 10 years and is passionate about helping moms navigate pregnancy and postpartum challenges to feel strong and confident in their bodies to enjoy motherhood. She is a mom to 2 awesome little boys, wife to her high school sweetheart, and enjoys the beach, camping, and exercise. I love that you included about your boys and what you do, and that you have that long relationship with your spouse, in addition to all of the accomplishments that you've gone through in a short period of time.
Yeah. I mean, honestly, I wouldn't be a pelvic floor physical therapist without having had the pregnancy, birth, and postpartum experiences that I did. So those experiences sparked my interest, drove my need really to dive into this world of pelvic health.
And we're going to unpack that a little bit later. But before we get there, would you be open to sharing a cycle story and about what age did you start cycling?
Sure. Yes. So I am not sure what age. I'm going to guess about 11 or 12. So I've been an athlete my whole life. And I remember first getting my period during this time period that I was doing this softball clinic. That was my main sport, right? That's what I love. That's what I did in college. And I remember thinking, oh my gosh, I can't do softball. This is what am I going to do? How am I going to have my period and do this? So just, being that age and just thinking how do you manage all of this and what my focus was on at that time. That's what sticks out to me when I remember back to my first cycle.
Yeah, it's a lot to unpack at that age, and how is this bleeding gonna affect your passion for your sport?
Mm-hmm.
And with being an athlete, did that impact any of your pregnancies? Or did you find that you struggle a little bit with infertility, or that your cycles were irregular, or were they regular?
No, I've been fortunate to have regular cycles, but that is something that I talk about a lot with my moms, when I'm seeing them postpartum, about the importance of the cycle. As, Red S is becoming more, I would say, talked about, especially in the lactating athlete, right? So now more moms are probably active than they were before. There's more postpartum moms that are athletes. We're seeing more moms in the Olympics. So it needs to be talked about, and the importance of nutrition and all the other things that you talk about in maintaining that healthy cycle.
We kind of wrapping around back around to what you were saying about how you got into this. What was some of your journey to bring you into pelvic floor and to physical therapy? Because it's something that is, I really haven't heard about it before getting into. I kind of did, but it's really starting to explode right
Mhm.
now in the health and wellness space.
Yeah. So I've been a physical therapist for about 10 years. I've done pelvic floor related work for about like 5 to 6 years. So after I had my first son, I was having some orthopedic pain, some pelvic pain, some groin pain, but then also some pelvic floor issues. I was having a lot of pelvic floor heaviness. So I knew I like needed to go to pelvic floor physical therapy, which was super helpful. But I also just for myself, I'm like, I need to put together the pieces of why I'm having this musculoskeletal pain and also these pelvic floor issues and how they were connected. So that's kind of what like sparked my interest. So just more out of like the desire to help myself heal, but also just realizing that moms really need help with this, not only from the physical aspect, but the mental health side of postpartum recovery, having that support. Pregnancy and postpartum are the biggest transitions in life, and it's a time that we kind of have the least amount of support. So I just like helping moms navigate those challenges.
For those that have heard pelvic floor, would you describe exactly what is involved with pelvic floor? Like, where is it? Some of the muscles that are involved, how you may know if you may not necessarily need, but could
Mhm.
use pelvic floor therapy.
Right. So I'll kind of go over first, like the indications of signs that you might benefit from pelvic floor physical therapy. So one of the big ones is incontinence or leakage, and that could be urinary or fecal. Feeling like heaviness in your pelvic floor area, being having prolapse or officially being diagnosed with prolapse. If you've had a C-section and you have scar pain, if you've have just a general abdominal pain postpartum, core strengthening, having a diastasis recti, which I can talk about a little bit more later, or having pain with intimacy. That's a really common reason. General musculoskeletal pain, groin pain, pubic symphysis pain, pelvic pain, back pain, hip pain, all of those things can be related to the pelvic floor. And I wish I had my model here. I left it in the office. But the pelvic floor is a group of muscles in the pelvic area that basically go from our sit bone to sit bone. So you think you're sitting in your chair, those knobby little bones in your butt. It goes from sit bone to sit bone, and then it goes front to back. So from pubic bone to tailbone in the back. And it creates this sling of support for the pelvic organs. So it creates support. And then they also have sphincteric function, basically meaning it surrounds the holes, it surrounds the openings, it surrounds the urethra, it's in the external anal sphincter. And then it plays a role in stability. It is part of our core system. It works directly with your breath, with your deep core, with deep low back stabilizing muscles as well. And it has a sexual function as well. So those are kind of like the S's, if you will, of pelvic floor function.
I love it because I know as a teenager, I love jumping on trampolines. However, I always peed myself every
Mhm.
time I would run. I would jump, I would laugh, I would sneeze. And I was a teenager.
Yeah,
And then I
right.
found out once I was pregnant with my son, with my older son, they're like, your cervix is sitting super low.
Hmm.
So we advise you not to do certain activities because you could harm your cervix, putting you into premature labor. Once I found out kind of about the pelvic floor, and I learned that the pelvic floor could be tight or it could be too loose.
Hmm.
I realized mine was too tight.
Right.
So are the same symptoms as being too tight as being too loose?
Yeah, so and people can kind of have both as well. It's like tension. We think of kind of like tension or weakness. But if you have tension, you're going to have the weakness too. So just like other muscles in our body, our pelvic floor likes to have full range of motion. So if you hold tension in the pelvic floor, which could be from a variety of reasons, like if people have had painful periods their whole life, a lot of times their pelvic floor is going to be tense. Like that's pain. Your body associates it in that area with, pain and guarding. Or if you have a mismatch in like core and hip strength, your pelvic floor is going to compensate and, have tension as well too. So the pelvic floor likes to be able to relax and contract. And yes, you can have tension in the pelvic floor, but also just general weakness. And both of those can present in similar ways. There are things I would say that are more common with tension, such as like pain with intimacy, low back pain, hip pain, more so than just when we see just weakness alone isolated.
Yeah, I think I got both because I definitely have the
Yeah.
hip pain, the lower back, like right above the hip,
Mhm.
and even some of the back pain. Yeah,
Yeah.
I can
And
definitely
like,
feel that.
interestingly enough, a lot of times people only start thinking about their pelvic floor like during pregnancy. And the pelvic floor changes during pregnancy. Our whole musculoskeletal system changes. Your pelvic floor is having to work a lot, right? You have a growing uterus like on top of your pelvis. But about 50% of adolescent female athletes leak during exercise during their sport. So it's a thing that shouldn't just be thought about, oh, now I'm pregnant. Now I think about my pelvic floor. No, if you were having these issues beforehand, it should be addressed then as well, too.
I- As I said earlier, yeah, I was in my teens
Yeah.
and I'd run, I'd pee myself. I'd jump, I'd pee myself. I was a
Yeah.
cheerleader and I was doing a lot of jumping.
Yeah.
And it's like
Right.
I I danced, not just at parties and stuff, the line dances and the jumping. And yes, I had incontinence.
Hmm.
So I'm very happy that you brought up about the teens and how if they're experiencing that, to bring that, even to talk to their parents about it,
Right. Right.
so that way they can address it, because I mean it's embarrassing.
Right. Yeah.
Why am I peeing myself?
Right. And I think sometimes people just like generally don't know what is normal, especially like postpartum urinary leakage has become normalized, right? Oh, you're a mom and you pee when you sneeze. That's become normalized. So people don't always know what's normal. So I'll go over like what is normal bowel bladder habits. So it is normal to go to the bathroom every 2 to 4 hours during the day to pee, which usually equates to about like 5 or 8 times a day. And overnight going like 0 or 1 times if you are not pregnant. During pregnancy, it's going to be more, it's going to be different. That would be normal. And it's also not normal to have sudden excessive urges to pee, something called like key in the door urgency. Like, oh my gosh, I get home and I have to go pee right now, or the water's running and I have a sudden urge to pee. It's also not normal to always just in case pee. Oh, well, I'm going to go run an errand and I'm just going to go pee just in case. Even though I don't have to go, I just want 5 minutes to go. I'm just going to go just in case. Your bladder shouldn't be dictating like your life. It's not normal to push pee out when you're sitting on the toilet, not to leak at night, shouldn't be having frequent UTIs, and your pee stream should be about 8 seconds long in general. And in terms of bowel movements, they should be pain-free, non-straining, and about every day to every other day. So I think that's helpful because a lot of times we don't know what is normal, and you shouldn't be leaking like when you jump, sneeze, laugh, or on the way to the bathroom.
Thank you for sharing what is considered normal, because we don't know. It's not talked about, and it's, and if it is, it's almost kind of taboo, like menstruation.
Right.
But by understanding what is the normal parameters of urination and waste removal from our body in general, we can see where we are on that spectrum.
Mm-hmm.
We can see, oh, are we not using the restroom every 4 or 5 hours? Is it longer than that? Is it every hour? Is there that urgency? I know I get stress. My bladder wants to release urine when I'm stressed. And I'm like, this
Mm-hmm.
is anxiety pee. Almost every time I go to perform of any form, it's
Yeah.
like it doesn't matter if I just went. It's okay, Heather, this is stress.
Mm-hmm.
This feeling of urgency is stress. And I know the answer to this, and I know that this might be an unusual question, but pain when urinating, atypical and outside of that,
Right.
that's something to be addressed, correct?
Right, definitely. I mean, that could be from a multitude of reasons. Sometimes it could be like a burning sensation. Maybe your pelvic floor muscles just have a hard time like sitting there and let go. A lot of times moms, they don't have time to pee or somebody's following them to the bathroom and they're sitting there power peeing. They're sitting there trying to push their pee out. That's not what we should be doing. And sometimes that like burning could be associated with some vaginal dryness as well, which can be affected by hormones during pregnancy, postpartum, perimenopause, menopause as well too.
Yeah, I wanted to address that because I know that there are some that do have that burning urination
Mhm.
and what could be some of the causes if it's not an infection, that they know it's not an
Right,
infection.
right. And
And
sometimes, people will have UTI-like symptoms. They'll go to their doctor, they'll have a workup. The urine culture will be negative for a UTI, but they're still having this urgency, this frequency, this burning, and it can be the pelvic floor being tense and not really like letting go and contributing to a lot of those symptoms. That's a pretty common thing.
that is very, very good to know.
Mhm.
A little bit earlier, you mentioned about, and I will probably butcher this because I usually do, but I know what it is. It's when the abdominal muscles during pregnancy they separate
Mhm.
and they don't go back together. There's
Mhm.
more than a certain distance between the muscles. How does that impact our pelvic floor? Because I know
Right.
that they're
Yeah.
connected.
Yeah. So the pelvic floor works as part of a system. It works with our diaphragm, our breathing muscle. It works with our core muscles. And like I said, works with like low back stabilizing muscles too. So it's part of this stability system. It's basically the bottom of the core. So, and during pregnancy, during the end of pregnancy, the abdomen needs to accommodate space for the growing uterus. Abdominal muscles, the two six-pack ab muscles in the front of the abdomen, are going to separate. They should. That is normal. There's literally a connective tissue that puts them together that is meant to like allow that expansion to happen. Most of the time for most moms, about 60%, by 3 months, that separation closes. Then there's a percentage that it kind of like lingers on. So, what we care about is can you activate your core, manage pressure in your abdomen? That is what we care about. The aesthetics in that separation, usually not a huge deal unless it is a significant separation, which sometimes people have, which would be more than like 4 finger widths between the muscle that I would say that is like a significant separation. Most moms are not experiencing that. Most of the times it's smaller than that. And one of the things that I really like to remind my moms of is if they're nursing, estrogen stores are lower. It is going to limit that connective tissue's ability to thicken up and close that gap, which is why that gap isn't as important. What we care about is, are you strong? Can you pick up your kids without abdominal pain? And do you know how to activate your deep core? So it gets a lot of attention in the media and social media and the news, and it can scare a lot of moms, but it is a normal adaptation. Most of the time, people don't have a significant one. And if you do have one, we need to strengthen your core. And every mom needs postpartum core strengthening.
Thank you very much for explaining that because I know that that is a big thing and you hear it. Oh, I still have this gap at 2, 3 years after I've had my
Mhm.
children.
Mhm.
And it's, I have the mommy pouch or
Right.
something of that effect, or they say that sort of thing. So I appreciate hearing that there is going to be a little bit of a gap. And yes, estrogen does play a role in
Mhm.
our muscles and how they repair themselves, especially if you're nursing, that estrogen and progesterone stay low
Mm.
because our bodies are just designed that way.
Right, right.
It, it's designed with the lactation to keep those other hormones low,
Mhm.
which is going to then impact all of our musculature system.
Right, right.
So I,
And that's like a common thing that I also see is pelvic floor symptoms coming and going within the different phases of the menstrual cycle. So, estrogen helps maintain strength and elasticity of the pelvic floor muscles. It provides lubrication, it provides blood flow. Right before menstruation, it drops. So, it's more associated with like less pelvic floor strength. People tend to have more prolapse symptoms, more pelvic pain, more leakage, more dryness during that time. So it's really interesting just how those hormonal changes are really actually affecting the pelvic floor's function and people's symptoms as well too. And a lot of times like postpartum, nursing estrogen stores are lower. It makes some of these symptoms a little bit harder to resolve. It doesn't mean that they can't be worked on though.
Thank you for bringing in about the cycle as well, because even knowing that, hey, you know what, first half of the month we're exercising, we're doing fantastic, we're not leaking, and then all of a sudden towards our period we're starting to leak, like what the heck is wrong with my body? And
Right.
then
Right.
you know that that is something that may happen because of where our hormones are, and it's
Mhm.
not necessarily that our bodies need necessarily attention, it's just what our hormones are doing.
Mhm.
What are, we've heard of Kegels. I say them incorrectly, and I've heard them both ways.
Right.
Do they help with pelvic floor? Is there a certain way to do them? Because I've heard that you have to do them a certain way, or they absolutely
Right.
do nothing. Are there
Right.
particular exercises to really kind of help either increase the strength of the pelvic floor, or actually, if your pelvic floor is tight, how to know that they're tight and how to release
Mhm.
those pelvic
Yeah.
floors
Yeah.
muscles?
Yeah, so what do we do, right? We know there's a pelvic floor issue, but like what the heck do we do to help it? So studies have shown that isolated pelvic floor strength is not predictive of heavy urinary continence. So what that tells us and what that means is, and we know this, so I kind of just went over this, is the pelvic floor works as part of a system. It works with our rib. It depends on how much our ribs can move, how much our diaphragm's moving, how our core is activating, how much hip mobility we have as well too. So when we have a pelvic floor issue, what I do is I look at how the whole body is moving and functioning, right? Like I solely treat moms. What are moms doing all day? They're bending down and picking things or people up all day long, right? So I look at how are they bending down? How are they moving? How's their foot and ankle positioning? Because that's going to affect the pelvis positioning. How's their hip mobility? That's going to affect the pelvic floor's function. Some of the deep hip muscles have fascial connections into the pelvic floor. So we want to look at how your whole body is moving and figure out the why behind it. Why are these symptoms evolving, not getting better? And then once we kind of look at the pelvic floor from the outside in, right? Then we can kind of dive in and like more detailed look at the pelvic floor muscles, which we can do externally, kind of like feeling from the outside, looking, observing from the outside. Or we could do an internal assessment if the patient is comfortable with it and if we feel like that's what they need and is appropriate. So the pelvic floor muscles are internal. The way that you feel them is intravaginally. You can also feel them rectally as well too, but there's 3 different layers of muscles and we can feel, all right, when you take a deep breath, I can feel what's happening at your pelvic floor. When we breathe in, our pelvic floor should naturally descend. When we breathe out, it should naturally come up. That's because the pelvic floor works with the nervous system. So that gives us information. All right, now I'm going to have you squat and move, and I'm going to feel your pelvic floor. Like what is happening? So that kind of gives us cues as to like what we need to like dive into and do. So the answer is yes, maybe sometimes somebody truly needs pelvic floor muscle strengthening. But that doesn't mean go home and do 100 Kegels. A Kegel is an isolated pelvic floor muscle contraction. You are never going to solve leakage jumping on a trampoline by laying on your back on the table, isolating just your pelvic floor muscles. So we want to find those muscles, kind of get in tune to our body where they are. Can we connect it to our breath? Can we connect it to our core? And then can we get up and moving and do a squat and think about our pelvic floor? Because studies have shown that we have more muscle fiber activation in the pelvic floor when we're doing it with a squat, when we're doing it with a lunge, rather than just laying flat on the back on the table. So the answer is to kind of like assess what the missing pieces and link are and put it all together within a coordinated system and not just isolated Kegels.
I love bringing in the whole body to this. And
Mm-hmm.
that's what you're doing, is you're bringing in the entire body. It's not just focused on one particular group of muscles.
Mm-hmm.
It's all of them together. It's kind of like the whole body workout versus isolating just the biceps or the triceps. Because if it could, like you said, it could be the hips. And
Right.
it could just be, it could be something else. And you could have a relatively strong pelvic core floor, but it's something else that's
Exactly.
causing
Hmm. Yeah.
the symptoms.
Right.
This has been absolutely amazing. Is there anything that you would love to bring
Yeah.
to my listeners that hasn't been discussed yet that
Mhm.
you really think is important for them to know about going forward, especially with the pelvic floor? Because I know that this topic can be huge,
Right.
and I
Yeah.
would love to hear if there's some things that you'd love to hear from them
Yeah.
about.
So two areas I think I'll touch on is just specifically some pregnancy and postpartum, like statistics, and then I'll talk a little bit about the genital urinary syndrome of menopause as well too. So the number one risk factor for having urinary leakage or incontinence postpartum is if it develops during pregnancy. So if you are having, I think everyone, any mom that's pregnant should see a pelvic floor therapist during pregnancy. And I always tell people like even 2 sessions can go such a whole like long way in changing your perspective, educating you. So, but if you're having urinary leakage during pregnancy, you are probably going to have it postpartum. If you have urinary leakage at 3 months postpartum, you have a 92% chance of having it at 5 years postpartum. So pelvic floor issues, they're common and they're persistent if you don't take intervention. It is never too late. A lot of times, like life happens, right? And people might not have the time, the support to, take care of themselves like postpartum like they would want to. But it is never too late. Obviously, it's a little harder, just like most things as we age are a little bit harder as we age, but it is never too late. Um, and one of the things I love to do is work with moms during pregnancy on all of the stuff we just talked about, because research shows us that if you do pelvic floor muscle training during pregnancy, and I go over a lot of birth prep topics with my moms of like how to push, what positions you should be in, thinking about your pelvic floor through all of this. But pelvic floor muscle training during pregnancy decreases the risk of instrumented assisted delivery. So that would be like forceps or vacuum. And those deliveries are associated with higher degree tearing, with more prolapse. And we know all of those things, higher degree tears, prolapse, are more associated with perinatal mood disorders, postpartum depression, anxiety. So these are things that sometimes we can prevent. Sometimes we can't. Sometimes somebody's going to just have a grade 3 tear because baby just came really quick. But some of these things we can prevent. And it's so important because it affects like the mental health of mom postpartum as well too. And then the last thing, pregnancy postpartum, is sometimes people think, well, I've had a C-section, like my pelvic floor is fine, right? That should be fine. Pregnancy affects your pelvic floor. Yes, there is more pelvic floor related dysfunction, such as urinary incontinence is 2 times more likely with vaginal versus cesarean delivery. But pregnancy affects your pelvic floor. I've seen plenty of moms that have had cesarean deliveries and they have pelvic floor heaviness, prolapse, incontinence as well too. So that's kind of like the pregnancy and postpartum piece. And then I can dive into the genital urinary syndrome of menopause a little bit too, as we were talking about hormones and whatnot. So that can be associated with like dryness, burning and pain, urinary frequency and urgency, and recurrent UTIs. So during that time period, estrogen stores are lower. And we talked about how estrogen helps the pelvic floor function. So seeking pelvic floor PT or OT during that time can be really helpful to help manage those symptoms as well too. So again, just why seeking help is so early, like early on rather than later, but it's never too late because life happens and there's never going to be a perfect time.
Yeah, I wish I would have gotten pelvic floor training, at least some sort of information when I was younger before my first pregnancy.
Hmm.
And it's now that I mean, my that son's going to be 17 here in a few days. My youngest will be 8. It wasn't until about a year or so ago that I realized that, like I said, I have a tight pelvic floor
Hmm.
versus a loose one, but I also have prolapse. I have all these issues
Right, right.
that pelvic floor therapy can definitely help with.
Yes.
Where can individuals find more about you, more about what you do? I know you're local to me, which is absolutely
Yeah.
phenomenal. But where can they find the services that you provide and potentially
Mhm.
be a client or just get more information?
Yeah. So my website, motherrecoverpt.com, I do in-person visits in Royersford, Pennsylvania, and then I do in-home visits as well too. So within about a half an hour of like the Pottstown, Royersford area, probably half an hour to 45 minutes really, I'll travel to moms' homes, which really just helps the access and convenience to care for moms that don't have to travel, half an hour to an appointment, pack up the kids, find a sitter, all of that. So just makes it more doable. And then I do virtual visits as well too. So that's really fun. Another thing, like virtual visits, easy for moms, hop on the computer. There's so much that we can. And then on Instagram, Mother Recover PTW.
All right. And all of those links can be found in the show notes so that's someplace that you'll be able to be found and you can go and check those out so you don't have to write that down. I love Mother Recover. I just love the name of that.
Thank you. I have to give credit to my sister-in-law for that one. When I was coming up with a business name, I was like, need help, and that was all her.
I love that. Before we go, do you have any wise words of wisdom to leave with us?
Yeah. So I like to say that your pelvic floor health is your health, right? It is your health, and you are worth taking the time, energy, and investing in your health.
So very true. Oh my goodness. That is so very true. Just learning about you, learning about how you work is vital to you. We are our biggest advocate
Right.
and we do have to put ourselves first. So thank you
Yeah.
so much, Sarah, for taking us
Yes.
on this enlightening journey into pelvic floor and what it is, what it isn't, how to
Yes.
know if you need or could use pelvic floor training therapy. This has been a wonderful conversation. So thank you.
I enjoyed it. Thanks for having me.
Oh, you are welcome. As said before, all the links can be found in our show notes. Thank you, listeners, for spending your time with us today. If you found a nugget of wisdom or a moment of empowerment, the mission is accomplished. Do you know someone who could benefit from this information? Please share Embracing Flow with them. So until next time, my friends, love hard, laugh often, and as always, be vividous. Talk to you soon. Thank you so much for joining us today. If you enjoyed this episode, please follow the show, submit a rating and review, and share it with your friends. Visit my website, embracingflowpodcast.com, to receive your free guide on 4 ways to decrease PMS. The link is in the show notes. Information shared on the Embracing Flow podcast is for educational purposes only. It does not constitute medical advice. Until next time, love hard, laugh often, and always be vividous.